So hello everyone and welcome to the webinar Improving Health Equity in Canada's African, Caribbean and Black Communities. My name is Rachel McLean and I will be your webinar moderator today. This webinar is being offered by the Canadian Public Health Association as part of a webinar series that we have been hosting over the last several months focused on the reduction of stigma associated with sexually transmitted and bloodborne infections. More information on this webinar series can be found on CPHA's website. You can also connect with me if you'd like further information or if you're interested in presenting a webinar as part of this series. Just before we begin, just a quick note to let you know that today's session will be recorded and made available on CPHA's website in the coming days. And throughout the course of the webinar, you can use the chat box for any questions or for any comments. So today we are going to hear from Sion Demike Abat. Sion is a member of the CHABAC steering committee and works as a community educator at HIV Edmonton. She has been working with marginalized communities for over 12 years and has also taught in higher education institutions in sub-Saharan Africa and Canada. Sion is passionate about health system strengthening that aim to improve health outcomes for underserved communities in Edmonton, as well as those that influence global health policy development and implementation. She is interested in the broader social justice and human rights issues and has published a book chapter, Women and HIV/AIDS in Sub-Saharan Africa. So with that, I will hand it over to you, Sion.
Rachel and CPHA for this opportunity to talk a little bit about improving health equity in Canada's African, Caribbean, and Black communities. Today is actually African, Caribbean, and Black Canadian HIV/AIDS Awareness Day. So I welcome everyone to this day, and it's a day to remember those people that are affected and infected by HIV and who are from the African, Caribbean, and Black Canadian population. I will tell you a little bit about the Awareness Day, its purpose, and then we'll look at some statistics, Canadian statistics, and then maybe focus in on Edmonton numbers. And I'll also show what HIV Edmonton has been doing in fighting stigma within, especially HIV-related stigma within the African, Caribbean, and Black population in Edmonton and around Edmonton. So the Awareness Day, CHABAC is an organization that coordinates the Awareness Day, and the first one was in 2015. CHABAC aims to raise awareness of HIV, promote HIV prevention, and contribute to addressing HIV-related stigma. The past 2 years, we've seen a lot of work being done, lots of events, proclamations, lots of media coverage, social media, and then also have ribbons, posters, and fact sheets across the country. A little bit about CHABAC. It is the Canadian HIV/AIDS Black, African, and Caribbean Network. It's a national network of organizations and service providers, other stakeholders, and respond to issues related to HIV and AIDS in Canada's African, Caribbean, Black communities. I will be using Canada's ACB communities from here on. So we have a national steering committee. I have served as a co-chair on the national steering committee for 2 years. I still sit on the steering committee. And we have regional hubs operating across the country that head the work in each city. CHABAC's vision is to end the HIV and AIDS epidemic among ACB populations in Canada. Our mission is to, we work to strengthen the response to HIV and AIDS epidemics and associated stigma and discrimination among ACB communities in Canada. And the website is also included if you'd like to learn more about CHABAC and our activities, or if you want to join the listserv as well. We have fact sheets that are really important and delve into issues into the HIV response in ACB communities. So I really recommend you to go and check our online presence. So just looking at sort of an overview regarding people from ACB communities and how disproportionately they're affected by HIV and AIDS in Canada. So Stats from the Public Health Agency of Canada show that in 2014, ACB communities represented an estimated 13.9%, or 1 in 7 people living with HIV in Canada, while only representing 2.5% of the population. A side note here, in some reports, you might see that they represent an estimated 16%, as opposed to what I have here, 13.9%. But these numbers and rates are taken from the Public Health Agency of Canada publication, and those indicate 13.9%. So I'm going with that. Also, to my second bullet there, in 2014, the same year, the estimated new infection rate among people from ACB communities was about 6 times higher than among other Canadians. So when you look at the percentage of population that represent ACB in Canada and the infection rates, we can clearly see that infection rates are really high within ACB communities. Thereby, ACB communities are disproportionately represented in infection rates and also in those people that live with HIV. So here's another way of showing the previous content. So here we see that 2.5% only looks like that white dot in the black pie chart. And then the next one shows you how many people, or the rate of people that are HIV positive that represent ACB communities. So ACB make up 2.5% of the Canadian population and account for 13.9% in 2014. In fine print, I also have black numbers, and that's how it's quoted in the Alberta health stats. So black account to 33% of newly reported HIV cases in Edmonton zone in 2013 and 2014 reporting. So that is 1/3 of the new infections reported 2013-2014. 1/3 of those are categorized as black. Now, when we look at the next one, we look at the burnt orange line in this graph denotes the heterosexual endemic category. You see that on this one, 2007 and 2008, there was a peak of infection rates, and then it seems like it has gone down. But it's really important to note that in 2010, Alberta introduced a new form of epidemiological categorization. So that one is denoted by the blue line, CIC-OOC, which stands for Citizenship Immigration Canada, which is now the IRCC, and OOC is the out of country. So when you look at numbers that are represented by the burnt orange line and by the blue line, you see that infection rates are also high in Alberta within the heterosexual endemic communities. That's a term that's used by government that represents African, Caribbean, and Black communities. So when we look at a different categorization in Edmonton zone 2013-2014, we look at 34% of Black population represents those that are newly diagnosed with HIV. Now, when we come to the same categorization of people that access support and access services at HIV Edmonton, we look at only 9% are registered participants of the support and outreach team at HIV Edmonton, and only those 9% get the Rose Armstrong Week benefits, which is if you are a registered member, then there's 1 week in a month that you can come and get any hygienic materials or vitamins, and also a grocery store card. So in the previous one, we saw that 1/3 of those that were infected with HIV in the years 2013 and 14 in Edmonton were from Black populations, but only 9% of those come to get any kind of support from HIV Edmonton. So there's a huge difference between those people that are living with HIV or have newly found out about their HIV positive status and those people that come to our support wing to get counseling, to get and other benefits. Okay, so when we look at those numbers, we asked ourselves as to why that gap was so huge. So we know and understand that determinants of health is a huge factor in how people make health decisions. Okay, so health influence, we know also understand that determinants of health influence vulnerability to HIV. And HIV positive African Caribbean Black community members have interlocking barriers that make medical help really difficult. And so among these are immigration status, employment status, sexual or domestic violence, racism, criminalization of HIV non-disclosure, and others. So we wanted to understand the huge gap in those that access service and those that were diagnosed with HIV, if it had anything to do with social determinants of health and what kinds of needs people have. So we took the message from this year's Awareness Day event, which is CHABAC organizes this Awareness Day, and the message is start a conversation, know your health options, and end stigma. So I'll go through each one of these with a focus on stigma. Starting a conversation. It's all about how people understand they can prevent transmission of HIV, or just even what it's like to live with HIV, and to learn questions about it, to also have a dialogue with family members, with friends and colleagues and others. So we know and understand that being informed and talking openly about HIV can help increase awareness of HIV and understanding of HIV, and also help reduce HIV-related stigma as well as transmission. But in some cultural settings and in some circumstances, that becomes a huge taboo topic. People are afraid to touch the topic of sex and sexuality and sexual health, and also sexually transmitted infections. These could be cultural issues, and also there is some kind of a barrier that people have, because sometimes we find that people know about HIV, but they don't have the up-to-date information. Or sometimes from the country they're from, they have one kind of education. Most times, if those are not up-to-date information, when they come here and we tell them a different kind or un-up-to-date information, people get confused. So we feel like it's really important for people that are living with HIV, as well as those people that are supporting or at risk, which includes everyone, to talk about HIV and get up-to-date information about stigma, about transmission and prevention and the likes. So knowing your health options also is a huge one. Why? Because it helps significantly reduce the risk of HIV transmission. There have been many changes in HIV prevention field, as most of you know, and it's important to learn about those different options. So knowing one's status is key to knowing your options. And for information about HIV tests and where to get one, we advise people to also go online, hiv411.ca. Also, CHABAC has some fact sheets about new prevention technologies, emerging prevention technologies in Canada's African, Caribbean, and Black communities, and I have provided the link below. Ending stigma. So people from ACB communities face multiple forms of stigma and discrimination, and HIV-related stigma is just one of these. And that's an interesting topic or concept. It's also something that especially service providers excuse me, within ACB communities a topic they need to unravel and understand. Stigma is an obstacle to HIV prevention. It's a huge obstacle to testing and treatment. I do have a lot of community members that I work with, I have the privilege of working with, that are really scared to even walk into an STI clinic or HIV Edmonton or anything that has to do with HIV. So the stigma is really huge, and in this situations, we try our best to go out of the office and meet people where they're comfortable to meet. Also, ACB communities can reduce stigma by talking about stigma and health issues, including the criminalization of HIV non-disclosure. We understand that the criminalization of HIV non-disclosure as being one of those things that it doesn't help people to get to go and get tested. Okay, it's a deterrent because people say that if I know my status, then I have the duty to disclose if I were to have sex. So because of criminalization, people are really afraid to go get tested. For more information, please see CHABAC's fact sheet, HIV stigma in African, Caribbean, and Black communities, and the link is also provided. So we know and understand that there's gaps between services that are provided, access to those services, also the number of people that find out about their HIV or are already living with HIV. So profound stigma and discrimination within some communities results in silence, reluctance to test, and difficulties with disclosure. Stigmatizing attitudes towards PHAs, people who live with HIV, based on assumptions about the infection. So, for instance, HIV/AIDS is a gay disease. It's an assault on manliness, things like that. Reluctance to engage and remain in care. We know and understand that being retained in care, making sure that people are taking their medication as prescribed by their physicians, and maintaining an undetectable viral load is really important for people who live with HIV. But sometimes because of stigma, because of fear, because of lack of awareness, people do not go to get tested, or once they're tested and they know about HIV, they're really afraid to access healthcare. So my last point is mistrust of the healthcare system, or the health system, or the healthcare providers. This also has something to do with previous experiences with the healthcare system or the providers themselves. So we see that there are gaps between service and the people that are living with HIV or those that are at risk of HIV within the ACB communities. But then, so why should we care? The medications are there, the research is there, the physicians are there. Why should we care about HIV-related stigma? People need to make their own decisions to go get help, to talk to their physicians, to be on medication, to make sure that they're doing everything they can to stay on medication and to maintain undetectable viral load. Those could be questions that we as healthcare providers and other workers ask. And here are a few ideas around that. So discrimination in healthcare environments, especially the denial of care or confidentiality breaches and negative attitudes or humiliating practices by healthcare workers, are deterrents. People are really, once they have that kind of experience, a humiliating practice with a healthcare provider, it's very hard for people to go and get engaged. Also, it can have a detrimental effect on health and well-being, may result in anxiety, depression, suicidal ideation, dissatisfaction with life, etc. It affects access to health and social services, and it also negatively impacts treatment and follow-up adherence. So example would be taking your meds and maintaining that undetectable status. Also, stigma is a barrier to HIV testing, and this is a big one because the more people find out about their status, and if it's an HIV positive status, the better they are taking their medication consistently as prescribed by the physician. Also a barrier to HIV prevention, and this leads to fear of disclosure as well. So I think because of these cases, everybody needs to care about HIV-related stigma. So kind of looking at stigma and testing, people avoid testing because they fear a positive result and the stigma associated with it. So for people living with HIV, fear of disclosure means that the virus remains invisible, which can lead to feelings of loneliness and despair. As a result, some people may be reluctant to access health and social services. The continued stress and isolation caused by stigma can worsen the health of people living with HIV. So again, focusing on testing, I brought in this part of an infographic from Public Health Agency of Canada to show that an estimated 1 in 5 people living with HIV in Canada are unaware of their HIV infection. So 1 in 5 people living with HIV are unaware of it. And 28% of that 1 in 5, 28% of people infected via heterosexual sex are unaware of their status. And 20% goes to people who use drugs intravenously, and only 18% of men infected via sex with other men. So still, 28%, the highest percentage here, is within heterosexual sex. So it's really important that if you're in any category on this slide, it's really important that people go get tested, because without being tested, people are unaware, and so they could be passing it on to another person, in addition to not really taking care of their health. So rethinking HIV-related stigma in healthcare settings. I think a little bit of discussion on this is important. So I'm basing this one on a study by Marie-Lou Gagnon from the University of Ottawa. This is a 2014 study. So there are different kinds of stigma in healthcare settings, and the study was done in inside a hospital in Ottawa and Montreal. So she talks about in her research, she talks about episodic stigma, symbolic stigma, and structural stigma. And some show isolated cases in episodic stigma where people have said in the study that they've always been treated really well except this one time. And the second one, in symbolic stigma, one person has said, because I was HIV positive, I was automatically labeled. So it shows some kind of label, and it wasn't something that was done all the time. In structural stigma, though, we look at a strategic use of labeling for risk management or other explanations to identify PHAs to properly manage perceived risk, and overlaps with HIV criminalization and interprets universal precaution. So that becomes a higher, bigger sort of systemic or institutional stigma. And when that institutional stigma is in different fields, we see that, or we understand that as a systemic stigma that people are facing, which in one way creates a distinction between the person who is accessing service and the other person who is giving service. So it creates this idea of power and privilege. And when you're talking about power and privilege, especially in healthcare settings, you're talking about privilege associated with race, gender, class, sexual orientation, and transgender experiences, etc. And also, you are identifying a sense of oppression that comes with that. So different experiences of privilege could also lead to oppression, and that becomes something that deters people from going to healthcare settings to get for treatment and for other important stuff that needs to be given attention. So kind of looking at the previous few slides, stigma and discrimination can come from the healthcare side as well as from within communities. So looking at African, Caribbean, and Black communities, people feel stigma or get stigma from within their own communities, but also as they go to access healthcare services, they could also encounter stigma and discrimination from the healthcare setting. And we've seen that it could be from the provider or just the system that's out there. And the second point is reducing the impact of stigma and discrimination requires varied approaches and is a slow and steady process. Just like working with community groups, just like you have to take it really slow but steady, making sure that people get trust and confidence, making sure that you are a friendly face around that group or organization. Even working at stigma and discrimination really takes a bit of time. So it's really important that we recognize that people from different walks of life and different areas of work need to come together to fight against the stigma that's out there. To my third bullet here, healthcare workers can all do better by learning the necessary skills to reduce stigma and discrimination. And that's mainly because of the power and privilege that exists within healthcare systems or just within society. But in understanding that, healthcare providers, healthcare workers can do a bit better in how people are treated within the healthcare system. An example of that at HIV Edmonton is a study or a project that we undertook with the University of Alberta, where nurses were connected to people who live with HIV and worked together to understand and recognize what things worked best for the people who live with HIV and how people who live with HIV should also understand the system and sort of be available to address issues with healthcare workers. So moving on, I will just show the kinds of things that HIV Edmonton has been able to do in collaboration with CHABAC in fighting HIV-related stigma within African, Caribbean, and Black communities, also in raising awareness. So a little bit of education, support, and also this big idea of fighting stigma within ACB communities. So HIV Edmonton, we have a mission of 0 new HIV infections, 0 stigma and discrimination, and 0 AIDS-related deaths, which actually was first recognized by UNAIDS, and we borrowed that from the UNAIDS. So when we began this work, we did a lot of community outreach, and this picture was taken at one of our events here at HIV Edmonton, where we gathered about 45 women from across different community groups for a really nice high tea kind of event where people came together to not necessarily at the beginning to talk about HIV and sexually transmitted infections, but to gather together and enjoy tea together and to see how we can collaborate. But surely at the end of the event, we invited people to come together and to collaborate with us in this amazing work in ACB communities. And that was one of the first things that happened. Now, having a look at this picture and looking all the fabulous women that are in that picture, it was a really big moment for us because you know, a lot of people are from ACB communities in Edmonton anyways, are afraid to walk into HIV Edmonton because of the stigma. But to have so many people come in to our building and participate in this fun event was a really great way of having an in the community. Now, after that, we had a capacity building workshop that was organized by CHABAC. CHABAC, again, is the Canadian HIV/AIDS Black African Caribbean network. So it's a network that has a steering committee, and the steering committee sort of guides the network, but also the network has different hubs in different cities. So after the capacity building workshop in Edmonton, we were able to create a hub, a group of people who came together once in a while to talk about HIV and how we can continue to raise awareness of HIV within community groups, to participate in health fairs, and also to to support individuals that are living with HIV in a very discreet way, in a way that doesn't um, make them feel ashamed, but we come together to talk about it and to see how best we can support. So that was the first capacity building workshop we had from CHABAC. And then the following year, we had an Awareness Day activity. This was the first Awareness Day activity. So we brought in a researcher from the University of Calgary to talk to us about the status of HIV in HIV positive people in Alberta. So she gave us an idea of the especially African immigrants in Alberta that are living with HIV, but also a good look at the immigration medical examination and how that affects people who try to immigrate to Canada. And then the other picture that you see on the slide is a coffee ceremony where we had someone come in and do an Ethiopian coffee ceremony for us. So the reason was that in Ethiopia, people, especially women, gather around the coffee and have chats. So usually they chat about their families, they talk about their kids, they talk about, if there's anybody that needs to be visited or is not feeling well, or anybody that needs support. So we took that same analogy and we said we can gather people across the Ethiopian coffee ceremony and have nurses and doctors, social workers, pharmacists, support staff, outreach staff come together and talk about how best they can support individuals that are living with HIV in Edmonton. So we had our nurses from the Northern Alberta program, also pharmacists, social workers, dietitians, and inner city support workers come together and talk about this issue and establish a group which can look at HIV-related stigma within ACB communities. What we saw in the following year was really amazing. We had about 65 people, and 65 is really big for us. 65 people from Africa Center come together. They were actually the Grand Marshals for that year's AIDS Walk for Life. So we were really fortunate to have a huge representation from the Africa Center, which came out to the walk and showed solidarity, and they showed their willingness to have these effective partnerships with us, which was a really great reward for the work that we had put in the Africa Center and other smaller communities in Edmonton. Last year at our Awareness Day, we brought in a physician from the STI clinic, and we talked about stigma, especially within ACB communities. And the physician talked about her experience of working with ACB men and women in her clinic. And so it was really nice for the other participants who were not necessarily from the medical field to understand what goes on in the doctor's office, one, and secondly, to understand how stigma still affects how PHAs, African Caribbean Black people who live with HIV, the discussion they have with their doctor. So she brought that forward. She gave examples and talked about her own experience of working with individuals, which was really eye-opening and kind of gave ideas of how we can, again, best support individuals. More pictures where we had a really vibrant young lady come from Toronto. This young lady, she had HIV since birth, and she talked about her experience and encouraged people in this work. We also were one of the cities that had a proclamation for the February 7th Awareness Day event. So in a way, to summarize the slides that I've shown and the presentation I've had, the key points. So we understand that we have made progress in the fight against HIV in general, but we also understand that we haven't done that in all areas. So what do I mean by that? Research and medication, has progressed a lot. We have medication, 1 pill a day that people can take, and with very low toxicity levels and with really low side effects. But not in all areas, right? Medication could be great, but to get the person to go to get the medication is another challenge, at least in some communities. Also, we have seen that some face these interlocking barriers differently than others. So everyone's challenges are different. And in the case of African Caribbean Black communities, the challenges that people face, especially barriers around language, navigating the system, a general feeling of stigma, and what power and privilege also creates, a sense of oppression. They all become obstacles for people to access services. So we all have a place in this. PHAs, people who live with HIV, social service organizations and workers, healthcare professionals, researchers, and those that are in policy. We all have a place in this to come together and work. Outreach and educational campaigns really help with appropriate information and access to healthcare. Also, community mobilization has a huge effect. So building readiness and capacity, sometimes communities and members are not ready. So you really have to gauge that, but building capacity and addressing the barriers are huge. Effective partnerships are very crucial for all of these things. In order to tackle these issues, the interlocking barriers that I have tried to examine in the previous slides, I think it's really important for effective partnerships to come together and act. So I have 3 slides that show the similar pictures, not same, but similar pictures. So in the first one, this talks about fairness and justice and the idea of equality versus equity. So in the first image here on the slide, we see that each person has one box, but not each person is necessarily watching the game. In the second image, we see that people have a different number of boxes. They're all able to watch the game. Now, the idea is not about taking one box from one party or one person to another, but the idea is what's equality versus equity. Which one gives people equal access to, let's say, healthcare? On the next one, a similar one, but more to a nod to reality. We know and understand that some people don't even have the chance to, watch the game. Other people have so many boxes that they're so comfortable in those boxes. But the last one shows that in this idea of equality versus equity, what happens if we just take the barriers away and we have a different kind of barrier, a lighter barrier, or maybe no barrier? Then everybody wins in that situation. So the idea is things are not equal for everyone. There are different ways of feeling barriers to healthcare, especially in HIV, and especially looking at the different groups that are disproportionately represented in the HIV rates and HIV numbers. But the idea is our healthcare needs to be a huge participant in fighting HIV-related stigma and create those effective partnerships to work with ASOs, with different agencies of the government, with social support, medical support services, and everybody needs to come together in a form of a group or a hub or a collective to address the challenges and the barriers that are that people face on everyday basis. that concludes the presentation, and I'm so glad once again that we're doing this on February 7th, which is the African, Caribbean, and Black Canadian HIV/AIDS Awareness Day. Thank you very much.
So thank you, Sion, so much for that informative presentation and for sharing some of the strategies that have worked well to reduce stigma and improve prevention, testing, and treatment efforts in ACB communities. And then also for highlighting, that there's still some really important work to be done. So at this time, I would invite our participants to please use the chat box to ask any questions to Sion. And just to note that these questions will be shared with all of today's webinar participants. So I'll provide you with just a few minutes to type your questions into the chat box, and then I'll turn it back over to Sion to answer your questions or your comments. So I'm not seeing any questions on the chat box. Feel free to if you have any questions, write them in the chat box. Otherwise, I just want to highlight the evaluation survey. So on your screen, you should see the link to a short evaluation survey. We ask that all participants complete this. It shouldn't take you more than a minute or so, and it just helps us improve future webinars and make sure that we're meeting your learning needs. So I'm just gonna wait a few minutes. I do see some folks are typing in the chat box. So we have a question from Candace. Sion, what do you think needs to be done to engage younger people in this awareness of HIV/AIDS?
So, for younger people in awareness of HIV/AIDS, what has worked for us is we have engaged them in the walk. We have done some interactive sessions with youth on racialization and immigration. If you're particularly talking about ACB youth, we've done that, and we've taken it further to encourage people to, for instance, include themselves in the Canada 150 project that CBC has invited people to participate in the contest. And so, okay, yes, ACB youth, good. So we've done that, but definitely with youth, it's always fun-filled activities. We have crafts that we just take to community organizations, and as we do the crafts, we just talk about sexual health, and we focus it on dating. Sometimes we talk about body image, and then slide in the conversation around using condoms, making sure that they prevent themselves from being infected. And we also talk about pre-exposure prophylaxis and post-exposure prophylaxis, and the idea that these technologies that are out there. So we definitely use interactive, informal sessions to engage youth. I hope that answers your question, Candice.
So thanks, Sion. So seeing no other questions, I think with that we can to end the webinar now. So just once again, please take a few minutes to complete the evaluation survey. And if you have any questions about today's webinar or about CPHA's webinar series on STBBIs and stigma, please get in contact with me. My email is on the screen there. So thanks again for your participation, and have a lovely day.